to punish yourself like that. We want you to come maybe a couple minutes before your appointment, because sometimes somebody else before you might cancel out and you'll be able to see the doctor earlier. So come a little bit before time, but not a couple hours before time, right? So this system is going to allow you to make a booking so you will know your time, and you come a little bit before and they will see you within that time slot that they have offered you. And then when you come now, with this paperless thing that we are talking about, there will be no card. So you will come, they'll go into the computer, they'll be able to see your name, and that can be done in seconds. So you don't have to wait for them to go find a card for you. It's in seconds they'll find it, and then you go straight to the doctor. The doctor would be not writing on a physical card. The doctor would be writing on the computer all their findings. And then from that, it goes from there. If you got to get meds, the medication that they prescribe goes to the pharmacy. You would go over to the pharmacy. They'll know the medication that you have to receive. And by the time you get there, they can even package it and have it ready for you, right? If you got to do a laboratory test, they take off the sample, it goes to the lab. When it goes to the lab, what happens? They'll process it. When the results finish, you ain't got to come back and wait there. That results go directly into your record, right? If you go and you get an X-ray or other forms of imaging, when they finish, that image goes into your record. So it's all there in one place. So you don't have to worry. We are going to release an app soon. Everybody know apps, right? So you go on your smartphone, you get an app, you can press the app, and you'll be able to get all of your records on your phone. That's where we're going, right? And that is very important because we want these things to be accessible. Now think about this other scenario. Sometimes you're at a clinic in the public sector and you decide that you want to go and see a doctor in the private sector, right? Now, you don't have your records from the public sector to take over. So you sometimes try to explain what is wrong with you, and maybe you don't get all the information correct. But in this instance, you can get your record and take it across because it is with you, right? All your records are going to be available to you. So whatever is wrong with you, you will be able to have those records with you. And I think that is extremely important. Now, once we get these systems going at these facilities, and then at the Georgetown Hospital, we are going to roll this out to the entire country. So first, we'll start with all the public hospitals, and then we go down to the health centers and then the health posts. So eventually, any facility in the public system that you go to, you will be able to use these records, you show up, and they would be able to see your whole history and what's wrong with you and treat you accordingly. And that, I think, is extremely important. So there'll be no difference between getting treated, let's say in Lethem, or getting treated in Georgetown, or wherever you're living, because all would be on the same platform. And then we'll work with the private sector to integrate this with the private sector so that as a country, everybody's record would be available. Now, while the technology would allow us to have this greater access, there are also potentially some challenges. What are those challenges? Now, with our medical information, we like to keep our medical information private to ourselves. We don't necessarily want to share that with anybody, right? We want to have that right to disclose to whoever we decide we want to disclose what is our medical conditions. Isn't that so? So we want to ensure, because now all of these records are going to be in one place. So we want to ensure that our records are kept confidentially, right? So that wherever it is, nobody can go willy-nilly and take our records and show it to somebody else. And for that, about 3 years ago, we went to Parliament and we passed legislation that is called the Data Protection Act. And in that Data Protection Act, one of the things that we put in that act is that if anybody, and we were anticipating this day when we'll get here, when we'll have this information together. So if anybody take your information and share it without your knowledge, let's say they leak your information, then they will be liable to a fine of 20 million Guyana dollars. So we're not making, this thing is not a joke. People's information must be kept confidentially, right? And that is why the penalties for breaching that confidence is going to be very, very high. And if you're an institution and you breach that confidentiality, then the fine is going to be $100 million. So this issue of confidentiality, we are taking it very seriously, and it is in the laws of Guyana to protect your data. So I want you to understand that. We have thought this out. We have been working at this for many years now, and we want to ensure that once we move to these types of systems, that your data is going to be protected. You are going to be in full control of your data. You would choose who you want to share it with. And I think that is extremely important, that you must be in control. Now, while we're working on this, we have recognized also, because this is one national system that we are building, we have recognized that if we are going to improve the quality of care that we are giving to people, that from the very, as soon as you're born, basically, we should have you in the system. And so we have started different things that we're doing right now. And at some point in the future, all of that would come together. So right now we have a school health program. In the past, when we talk about school health, we normally would think about one of the doctors here would go into a school and talk to the children in school about their health, or get a teacher to talk about health in a school, to the school children. That's not what we are doing now for school health. Every child, when you're coming in to nursery school, we have a screening program where we'll screen that child, check their eyes, check their ears, check their mouth, do a general checkup for them. And when we finish that general checkup, if we find anything that is wrong, then we bring that child into the health system and we are able to treat that child early. Think about a child probably that got an eye problem, not seeing properly, that can be corrected by spectacles. But because nobody would have tested the child's eye early, that child might have been in the classroom there, not seeing anything on the board, and therefore would have some learning impediment because they're not seeing or they're not hearing. Now we pick these things up early, we can fix it early. So one program that the ministry is running right now is that every child from nursery into primary we are doing that screening. When you move from nursery, from primary into secondary, we screen you again. So there are three screenings. When you're entering nursery for the first time, you're screened. From nursery into primary, you're screened again. From primary into secondary, you're screened again. And all of it is age appropriate, meaning that the tests that we do are for those specific age groups. And that information, we are collecting it so that we can keep our population healthy. So if we find that children of a certain area are too obese, then we can work with the parents, the teachers in that area to make sure we reduce obesity in that area. If we find that in another area that maybe these children haven't taken their vaccines, then we'll work with the people in that area to make sure that they get their vaccines. Because these things are to protect the health of people. Ultimately, with these types of systems, we want people to live longer. And once we are able to identify disease states earlier, we'll be able to work on their prevention or to delay the onset of these diseases. For example, a lot of our population, we're seeing diabetes. But what the science is recommending is that we can pick up people who are pre-diabetic. That's before they actually get diabetes. And once we work with them, their nutrition, their exercise, and other things, we can delay the onset of diabetes. And that's how we want these systems to work. So while you will be coming now, a lot of people are coming in now because they have some chronic illness or some thing that they want us to look at. We would want these facilities to also encourage people to come in and do prophylactic checkups, preventative checkups. We want you to come, get yourself checked. Don't wait until something happens, right? Maybe you got some underlying thing that is not showing up as a major symptom or so. Don't wait for that. Come in at least once a year and get these prophylactic checkups, because I think that is extremely important. We also, as you have seen, and you've heard many of the announcements from the president, President Ali has been a champion for healthcare in this country. And he's not just talking this thing because, you know, a lot of people can say things and nothing happens. But you all have been a witness to the transformation that is happening with health in this country. And some examples. Think about last year, 2025. For the first time in the history of this country, we opened in 1 year 6 new hospitals in this country. And that's remarkable. It has never been done. And by any stretch of the imagination, one would say, well, this is a major achievement. We can stop here. But we are not doing that, because already we have a number of other facilities that are under construction. Robbie just mentioned we are working on the Camberville, Kitty Camberville Polyclinic. We are working with one at Industry. But outside, if you go to Region 3, Region 3 would have a new West Demerara Hospital in another 2 years or so. We already started the construction of that hospital. If you go to Region 1, in Maruka, we have started the construction of a new hospital in Maruka. You go to Cato, we are starting a new hospital there as well. And in Lethem, there's a new hospital. Right here at Ogle, we have the pediatric hospital there. New Amsterdam Hospital. All of these facilities are under construction and would be completed so that people can get better health care. That's what we are aiming for. Just a few years ago, many of the X-ray units that we had, right? When you do an X-ray, we had to go then into a dark room and you had to watch the film. And then you come and you hold it to a light source to see what's going on with this person. Just 2-3 years ago, some of the X-ray units were 25 and 30 years old using this analog system. We as a government took a decision to change all of that into digital X-rays. And so now across this country, you have digital X-rays that are going to be compatible to your electronic health record. So we want to make it seamless so that it can integrate into your electronic health record. And now places that you didn't think would have X-rays, we are putting them in so that people can have access to these types of facility. And we want to go a step further, because with imaging, you can have artificial intelligence assisting us to read some of those images. And if you think that's too sci-fi or, sound like fiction, we have such a system right now that we are operating at the Enmore Regional Hospital, where once a digital X-ray is done, it goes into the system, and guess what? It takes 17 seconds for it to be read. And the accuracy of what is there is close to 99%. And that is something that we want to scale up. We are piloting it there, and that would be able to read not just X-rays, it can do CTs, it would be able to do MRIs when we have more MRIs in the system, and a whole host of other imaging. So this direction in which we are going, this is one that is absolutely necessary if we are going to deliver world-class healthcare to our people. So we want you to embrace this. We know anything that is new and innovative, it can also be a little bit frustrating, right? Because these changes don't come, it disrupts what we know and how we know how to do it. So we want to ensure that you help us through, and you have to embrace the technology, right? We are going to try to facilitate as much as we can to smooth out any problems that you might have. But we want you to have the patience to keep trying and making sure that you adapt to the technology. Because if you as the patients don't adapt to the technology, if you don't use it, then we are defeating all of what we have been trying to do. So you have to help us. That's a major thing. Because if you embrace it, it is going to work for us. And then our staff here, over the last couple of months, they have been working very hard to ensure that they understand how to work with the system. And they're getting better at it every day. And I'm sure as we roll out and we go to the other centers and so, we are going to adapt. But everybody, it's a learning process, and we all have to learn together. But if we embrace this and we do it well, we will all share in the benefits. You would no longer have to come here and wait a long time, right? And I think for many people, that's going to be a big plus. Isn't that so? And it's going to be more efficient, more productive for everybody. And from the medical end, we will also derive many other benefits, including understand the profile of our patients so that we can plan better for those patients in how we treat them and what we can do. So today is a very important milestone. And as everybody did, I want to thank all of those who have been involved in helping us to get to this point. But this is just one step forward. There are lots of other steps that we'll have to make. And as I've said to the CEO and his team at the Georgetown Hospital, this one is relatively small. The Georgetown Hospital is going to be a bigger challenge. And I'm happy that they have embraced this, they have owned the process, because with that ownership, that is what we need to make sure that we have full success at the Georgetown Hospital. It's going to help us to make sure that the services that we are delivering, the specialized clinics, the way that we plan surgery, and all of that would be improved significantly. And so as we move from here to the Georgetown Hospital, I hope that the team would ensure that we meet those benchmarks that we have set ourselves, and that every department would work tirelessly, take the training, ensure that you understand how to use the system, so that when the system is deployed, we don't frustrate people. And that is very important. We want this thing to be seamlessly deployed. We have recognized that sometimes as you deploy these types of systems, that you need technical people to assist. And so another program that we are running parallel to this one is that we have set up a digital health institute that is being run with the assistance of Mount Sinai and is funded by the Greater Guyana Initiative. And right now we have about 60 young people who are in training to assist with this rollout of this service. So when the thing is being deployed, if you need technical help, these young people would be there to offer technical assistance. And as we go across the country, we'll be employing more of them so that they can support the system. So, as I said, today is a great day. And as we go live, make sure we use the system, make sure we support the system, and let us make sure that from here, we spread and go to every single facility that we have in the country so that all Guyana can benefit from this digitalization process. I thank the team and I wish all of you well.
Thank you, Minister, for your insightful remarks and for championing the provision of world-class healthcare for Guyanese. Ladies and gentlemen, we will now proceed to an exciting and practical component of today's program, the live demonstration of the EHR system. And this demonstration will provide a first-hand look at how the system functions and how it will improve patient management, record keeping, and service delivery. I now welcome Mr. Hal Mohammed from RioMed to begin the live demonstration.
With all official protocols observed, good morning and welcome everybody. A special thanks to the community around Festival City and the general public for coming out today and battling the weather to support our launch today. My name is Hal Mohammed. I'm the regional manager at RioMed, the Government of Guyana's electronic health record partner. It is truly an immense privilege and honor to be with you today to announce the launch of the EHR system. As the previous speakers, I'm not sure they've left much for me to say, but I'll do my best. It's a really big step forward in the digital transformation of Guyana's healthcare economy. So what does the EHR mean for you as a citizen of Guyana? EHR is about making your healthcare visits safer, smoother, and more personal. I want to share with you today a small window into the new system. I'm going to take you through how patients can book, everybody in the room here can book appointments online, can visit the clinics, and view their health record online. Can we start the video, please? So online patient booking and digital patient access are now available for festivals. Is available for Festival City Polyclinic. This is available by the myhealth.gov.gy app. Guys, the video. And it's also available by the QR code that you've seen around on the back of people's t-shirts. And it will be posted and has been posted all around. Guys, is the HDMI cord in, guys? It's not showing on the screen properly. So you'll see that there's a QR code that's up on the screen. Anybody can access that QR code, search for an appointment. You will have to enter a email address or a mobile telephone number as a method of verification. Guys, the video. Just leave it to play from here, please, guys. So once you've selected your service, can you leave it to play from here, please, guys? Please leave it to play from here, guys. Once you scan the QR code, you'll be able to view the services that are available at the clinic. You can select your date and time slot for appointments. You can select an appointment reason and add any notes that you would like the receiving physician to see. Today, we're searching for services available at Festival City Polyclinic and a general wellness appointment. Once your appointment is selected, you're asked to enter some additional information, including your name, your mobile telephone number, your gender, and date of birth. This helps us both secure and identify your record that you are who you say you are. Once we have your mobile telephone number and your email address, we're able to validate and secure your record. Once it's booked, you'll receive an email or text message confirming the details of your visit, and this can be viewed by your My Health portal or on your email or SMS that you will receive. We're now going to move into the day of your appointment at the Festival City Polyclinic, and in future, any polyclinic. The users at the polyclinic will access using their unique credentials, unique role-based credentials. So your registration staff will have a very different view to your doctors, your nurses, phlebotomists, imaging staff. You will be in the waiting room because you have set your appointment. The provider will select your record, access the patient summary, and here the doctor has reviewed you for your hypertension and is going to prescribe the hypertensive medication that you're on. Here we see amlodipine 10 milligrams being prescribed. You can see how easy it is for the doctors to write your prescription. I know doctors don't like to hear it, but people complain about doctors' handwriting and not being able to read it. So we can see amlodipine 1 tablet once a day for 30 days being prescribed with a review date of a month's time. The doctor then reviews the prescription for completeness and it is queued for dispensing at the pharmacy. You finished your visit now. And as we've mentioned, I am sure guilty of being prescribed a medication and I can't remember the name of the medication. I'm sure we've all been in that position. And it's very handy now to be able to access your portal and see what medication you're on and any notes or communication that has been sent to you by your physician. This is a taster of what's to come in the system. It's being piloted at Festival City Polyclinic, being rolled out at Georgetown Public Hospital next, and to other facilities around the country after that. Festival City Polyclinic now operates using a fully integrated digital EHR. Last week, the staff of Festival City completed over 500 clinical assessments in their first week using the system. From the reception through registration, clinical consultations, investigations, and pharmacy services, the patient journey is managed with one connected platform, supporting continuity of care and reducing reliance on paper-based processes. I think almost everybody in the room who's here for the health fair has now been registered for the eHealth solution, and you will now have your record on the national EHR platform. A very special thank you to all of the hardworking teams at the Ministry of Health, GPHC, and the very brave staff at Festival City for taking the leap and making this project a reality. Please enjoy your day at the health fair today that's been provided. There are a multitude of services on offer. There's a huge change in the way in which healthcare is being delivered. The ultimate focus is on the betterment of patient care. So please be patient with your doctors, nurses, and health professionals as they adapt to a new way of working. The digital transformation they are undertaking is for you. My team and I will be around all day to answer any questions you may have on the EHR, and please enjoy your day again. Thank you.
Thank you, Hal, for the demonstration. And before we move on in the program, like Hal just mentioned, I would like to take the opportunity to invite everyone here today to take full advantage of the free and readily available health services being offered. Please feel free to visit the various stations, interact with the healthcare professionals, and benefit from the services provided. Ladies and gentlemen, we are about to have the official launch moment, and a milestone like this deserves a special moment of recognition. So the team that brought this project to life has prepared a special video for us to commemorate the launch of this initiative. And I was asked to invite the Honorable Dr. Frank Anthony to join me at the podium and count us down to the official launch moment. Minister, please join me. We will count down from 5.
Okay.
I will ask the team to have the video on standby. Oh, the countdown is on the screen. Okay, so please turn your attention to the screen.
10, 6, 5, 4,
3.
2, 1.
And there we have it. That was the launch moment of the electronic health record system. That was a milestone that we just celebrated. And it was done electronically, of course. And now I am going to transition into the closing of this program. And it is my pleasure to invite Dr. Amit Raj Prasad, who is the doctor in charge of the Festival City Polyclinic, to deliver the closing remarks. Please welcome Dr. Amit Raj Prasad.
All protocols observed. Special good morning, everyone. As we bring today's proceedings to a close, I want to pause and reflect on the significance of what we have accomplished together. The launch of the electronic health record system here at Festival City Polyclinic is not just a technological milestone. It is a promise to our patients, our staff, and our community that healthcare can be smarter, more efficient, and more compassionate. This achievement is as a result of dedication, collaboration, and vision. To our Minister of Health, Honorable Frank Anthony, your support has been remarkable, and I extend special thanks to you and your team. Your vision for strengthening healthcare delivery ensures that this transformation will benefit generations to come. To our GPHC team, including our CEO, Mr. Robbie Rambaran, all directors and support staff, IT, electrical, every single department, especially Dr. Hatton and team, thank you for your unwavering commitment. Your dedication has set a strong foundation for success of this initiative and for future advancements. To the Mount Sinai team, your support has left a lasting mark on each member of our Festival City team. Your expertise and collaboration have elevated the quality of this project and enriched our collective learning. To the RioMed team, thank you for your patience. We look forward for continued support in the weeks and months ahead. Your technical guidance has been invaluable in ensuring a sustainable implementation. Certainly not least, to the Festival City team, my team, our team, the Dream Team. Your resilience and adaptability have been nothing short of inspiring. To our nurses, doctors, pharmacists, clerical staff, and all other support staff, your hard work and countless hours of dedication over the past months are clearly demonstrated here today. Your willingness to embrace change has been a deciding factor in this success story. It is with great respect and gratitude that I thank you all. The continuation of patient and family-centered care at Festival City Polyclinic, now merged with digital transformation, will make healthcare even more accessible to our community. The online booking platform will be further promoted in ensuring that patients can conveniently book services at their fingertips. As we reflect on this achievement, let us remember that today it is not only about technology, but about people, our patients, our families, and our dedicated staff who make care possible every day. In closing, I want to emphasize that today marks a bold step into the future for Festival City Polyclinic. Together, let us move forward towards a healthier, more efficient, and fully digital Guyana. Thank you.
Thank you, Dr. Prasad. And I have to say, I love the enthusiasm of this crowd today. You guys have been doing very well at cheering everyone on and celebrating this initiative. But ladies and gentlemen, this brings us to the end of our formal program, but the health fair continues throughout the day. On behalf of the Ministry of Health, the Georgetown Public Hospital Corporation, and the Festival City Polyclinic, I would like to thank all of our presenters, special guests, and attendees for your participation and support. Thank you once again for joining us, and we wish you a healthy and productive day ahead.